Welcome back to BioNexus Health Podcast. Today, we'll be speaking about fatty liver disease. We'll be speaking to Wendy from New Jersey. And Wendy has had quite an arduous journey dealing with her fatty liver disease. She chose to go with herbal medicine, completely plant-based approach. And recently, within a few months, we saw her liver scans come back completely clear. Her specialists were pretty much, astounded. And Wendy's happy. She's ecstatic, over the moon. So I'm happy to welcome Wendy to today's podcast.
Welcome to the BioNexus Health Podcast with Dr. Jody A. Darshore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jody A. Darshore.
Hey, Wendy, how are you today?
Hi, how are you?
I'm doing well, thank you. Thank you. Yeah. So I'm glad to see that big smile today. Because, I remember when I first met with you, it wasn't that long ago, but, when I first met you, you had a lot of issues going on, right? So
Yes.
Can you tell me about your fatty liver disease and all of the other chronic issues that you were facing before I met you?
When I first met you, I had a lot of burning skin going on. Like every time I would eat, I would have like irritated burning skin and like heavy sweats or night sweats. I had fatigue. I couldn't eat a lot of things. A lot of things have gotten better for me. I don't have the burning skin anymore. I had a series of doctors I went to that had looked at my liver and they knew something was wrong, but they couldn't figure it out. Even my GI he was scratching his head. Like my liver just kept getting fattier and fattier through ultrasounds. And I had a fibro scan by my integrative GI and he kept watching it. He was getting worried. And then when I came to see you, he was still like watching it. And when you ran the tests, when I saw you, he said, I want to see you back in 6 months. And then I went on your protocol. And then like 6 months later, his mouth dropped to the floor. He didn't understand how it went from an inflamed fatty liver to the test was normal. The ultrasound and the fibro scan was normal.
Wow. I know I was over the moon with you when you were, when you sent that message that, hey, it's completely normal. And then I remember we had a follow-up soon after, and you mentioned this to me. So that is great. So for how long were you suffering with your chronic illness, the symptoms, and what diagnoses other than fatty liver had been given for you?
When I first got sick with Lyme, I didn't know I had Bartonella at the time, and all the doctors were giving me antibiotics. I mean, I think the total is like 6 years. They kept giving me antibiotics. I was getting discomfort on the side. I was going for ultrasounds, and everybody's just like, I don't know why you're having the pain. And it just kept getting worse and worse. I mean, I had a lot of inflammation, and it was weird. I would eat and my skin would burn, and it was like a high irritation, and I never experienced, and I was fatigued, and I had doctors telling me, some of them knew that it was my liver, but they didn't know why it was happening. So when I had everything done, and then when I finally came to see you, you put me on your protocol, and it helped. It healed my liver. Like I was really concerned because, well, liver beside your skin is one of your biggest organs, and helping you.
Yes. Yeah. Yes,
Yeah.
A liver has 500 or more different functions in the body, including, digestive help, detoxification. I mean, that's just absolutely touching the surface, but those are the two really big ones, right? Detoxification and digestion. And there are so many other functions that the liver does. It's a very large organ, as you must have seen from your scans. from your liver scans. Was 6 years is a long time. So what made you
Yes.
decide? Yeah. So after doing all of the conventional treatments for Lyme disease and infectious diseases, what made you decide to go for plant-based herbal medicine?
I was seeing my last integrative doctor that had recommended you because she didn't know what to do with me anymore because I kept going in circles. She had me on antibiotics. She had me on some herbals, but not a lot. And it was just wasn't working. And I knew like you can only take so many antibiotics, like it destroys your system. So she had recommended you, and I figured I would give it a shot because that's what I wanted. I wanted to go straight holistic anyway. And I knew it would be better for my body. It would be better for like my gut flora, like overall health. Like it's just natural is just better from what my journey that I've learned. Like even food that you eat, it's just natural is just a better way to go. And it's made a world of difference. Like taking the herbals and even like the environment with the herbals, like cleaning with the herbals, like holistics, and also eating and then taking the holistics, it's helped a lot. It's made a world of difference.
With your health overall? Sorry.
Yes. Because I've had the Lyme and then the Bartonella and then the series of viruses that come and go. And then it's hard to function. It's hard to function every day-to-day life, just getting up and walking from your car to work, and doctors were telling me I was fine. Here, take these meds and take these pills. And I was just like, I should be able to go to the supermarket and pick up 5 or 6 items without needing to sit down. I mean, I'm not old. You know what I mean? I'm like, I was healthy. I used to work out in the gym and stuff, and I didn't understand. And they were telling me I was fine, and I knew I wasn't. So yeah, it's been a long journey for me.
Yeah.
And a lot of people, I feel like they don't understand. So
yes, unless you are obviously you have broken bones, braces,
unless it's
unless it's visible, it just becomes an invisible illness. I remember I've got people coming up to me at Target, why are you parking in the handicap parking? You look fine. And then my little son comes out, and then I pull out his wheelchair, and they're like, oh my God. I'm like, really? You need to
just because you can't see it doesn't mean a person's not suffering.
Right. I mean, I had stage 3 Lyme, so did my son. His was more visible than mine, but we were both ill. It was hard to just walk from the handicap spot. It was hard to walk into the store and any big store, walk around without resting, like you mentioned. Yeah.
It was just, and then when doctors just give you conventional drugs and they tell you, here, take this for this symptom. And then I knew something was wrong, and I knew that wasn't going to help. I didn't want to treat the symptoms. I wanted to treat the cause. So that was another reason why I wanted to try holistic and try your protocol.
Yeah, root cause medicine, it really works. Especially I'm especially grateful to your integrative practitioner who actually recognized. I'm grateful for her recognizing that, and she's not the only one. There are many practitioners who I'm friends with. I've mentored with them. They've mentored with me. It's been mutual help to see how we can help people the best. And good integrative practitioners understand that even though they are integrative and they do incorporate, some herbals, some supplements into their protocols, often people with chronic illness are so severe. And if they are not really responding well, that's because they need someone with a full-time knowledge of herbals, not just, what the company representatives tell you. Like, here's my herbal product. Here's what you use it for. This is for Lyme. This is for Bartonella. Here's the standard cookie cutter protocol. It really doesn't work for many people with chronic illness. And I often see that I get referrals from integrative practitioners who would like their patients to see someone who is a full-fledged herbalist, so we can customize things to you.
Yes,
that's key. I think I've had the best results when we run individualized labs like we did with you, and there were so many things we discovered which were never discovered for you before, right? Inflammation,
Yes. Yeah.
genetics.
It was just, I just kept going in circles and I wasn't getting answers. And it was just, I mean, I went from a person that, worked out in the gym and ate anything they wanted and did anything they wanted, and to I couldn't even go, like I said, go to the supermarket and pick up like 4 items. Like I had trouble at my job's physical. I work with autistic children. Like I couldn't function. Like it was not easy for me. It's been a long journey. And when I try to explain it to people, they don't understand. I've had doctors tell me, well, you don't look sick. I'm like, well, that's great. It's good to know. Yeah,
Right,
it's
right.
been a long journey.
So you work with special needs children, and you do need your strength, your energy, your wits, your brain. All of those things are so crucial, right? When you have these little precious little ones entrusted to you. Yeah.
Yes. It's just when you're having brain fog and fatigue and you're working with an autistic child, it's not easy. You have to call out sick and be out a lot. It wasn't easy. It just was. And I'm a stubborn type. I look for answers and I keep going. So I push through and I find an answer because I'm not the type to quit. So.
I love that about you. That you understand die-off reactions. You understand that sometimes you have to push through, and you have demonstrated a lot of courage through a lot of adversity.
Yes. And what I did learn in the journey when I started your protocol, I never knew that, because I know you did some genetic testing. I never knew that. Because it's different for each person. Everybody has different symptoms. I never knew it was because of genetics. Like I never knew, like with my issue and mold and whatnot, that I had the mutations, that someone next to me who could have gotten bit by a tick maybe doesn't have those and has different issues, doesn't have those mutations. I never knew that Lyme attacked people depending on their genetics. That was a big eye opener for me. I guess that's why everybody's so different.
That is very true. Yes. I kind of discovered it late on my son's journey as well. I mean, we started treating when he was started to show symptoms at 6.5. I think there were symptoms much before, when he was diagnosed autistic, because there is Lyme-induced autism, and I wasn't aware at that time,
Wow.
But yeah. So eventually we found out what really the root causes were. And then one by one, establishing priority, looking at genetics. That was the best part, was giving a customized protocol to each individual, including, that's what happened with my son, and completely plant-based, so there are no repercussions with the gut, no side effects. And that is what helped the most, because it was completely customized to him and to you as well. And that's the best approach. And additionally, we found a lot of infections, we found toxins. So these can all build up when your body is dealing with chronic illness and is not able to function the way it used to before chronic illness set in. Right, it becomes a really heavy load for your immune system and all of the other organs in your body, pretty much. Lyme disease and mold illness, it is systemic. It attacks many systems in the body.
Yeah. And then when they put you on the conventional drugs and they kill your immune system, it just makes it worse down the road. In the beginning, it's great. You feel great. But then down the road, it just snowballs. I was just snowballing. And it just kept going in circles. It's just, some people that don't understand, you can't, unless you go, I don't want people to go through it, but unless you experience it, you can't understand it. Like having Lyme, it's just, I I don't even know how to explain it in detail, but yeah, that and Bartonella, and and sure everybody else had different, like other people that have Lyme had other co-infections and different things going on.
Yeah.
And it's sad because it's made me a little nervous. Like I used to hike a lot and it made me nervous to like hike in the woods. I'm gotten better. I spend more time in the beach, if anything now, but
No, that's
I don't
good.
really, I love the sun, but I'm a
Yeah.
little nervous when it comes to going in the woods. I mean, there's ways to protect yourself through your protocol. I've learned I know on the list, there's certain things on there, but I'm still, I guess it's kind of like a post-traumatic stress kind of thing going on.
Well, absolutely. Yes. Going through everything that you've been through, yeah, PTSD does set in. As you get better and better, stronger, you will feel more confident
About going, yeah.
going out more. So let's talk about your improvements, your gut. What improvements have you seen with your gut, with your energy?
I have more energy. I definitely have more energy. I'm walking. I haven't tried lifting any small weights or anything like that. I want to keep it simple. I just want to do walking and start out slow. I could function at work now. Because I mean, with working with autistic kids, it could be very busy. So I'm able to function. I don't have brain fog anymore. My food has gotten better because at one point I was only eating meat and vegetables. I couldn't eat anything, nothing at all. Like every time I ate something, I would be like irritated skin, burning skin. It was horrific. And it was either if I didn't feel anything right away, I would feel it 4 hours later. Like it was like burning. Like I was gotten scared because when I first got sick, I mean, I have a cat and my cat walked on my, and you sit with your animal and your animal will just walk on you to sit in your lap. And my cat would walk on my stomach and my skin would burn. Like my skin was pushing toxins out. I had so many toxins. That was when I first got sick. And the fatigue and the joint pain and the brain fog, it was just horrific. I mean, I could function now. I could work my job. I could go to the store and pick things up. I sleep through the night. I'm starting to sleep better. I mean, I still get the sweats a little, but I think that's normal for people. But I don't have that burn. I think the burning skin and the swollen joints and the joint pain and the fatigue was the worst. And I had that every time I would eat. I got to the point I didn't want to eat because it was just, I wasn't eating to enjoy things anymore. It was just eating if I was hungry, but I didn't want to eat because I felt horribly sick and I didn't have the energy. And it was just, the fatigue was really bad and the headaches, it was just bad for me, and nausea. I don't hardly even get any more nausea anymore. Like it was just, and I know a lot of like the burning skin and the nausea, that's all has to do with my liver. It was my liver pushing toxins out and it just couldn't handle it all. It was pushing to my skin to deal with it. And my skin couldn't even handle it because my skin was burning. I felt like someone was taking a torch to my skin. It was horrible. I don't wish that on anybody. I'm grateful that I don't get that anymore. It's not something I would want anybody to go through.
And you had all of these symptoms after going through pretty intensive conventional treatment for Lyme disease and co-infections. You were left with these symptoms, and many times, which is why I said I'm really glad that your integrative practitioner knew what to do and who to refer you to, because oftentimes this is just labeled as post-Lyme syndrome. What do you mean post-Lyme syndrome? Well, then we try intravenous, then oh my goodness.
No, they had doctors had mentioned intravenous antibiotics, and I was already on antibiotics for a year on and off by different doctors, and they had already killed my gut. So I was like, I'm not going to kill my immune system even more. And it's not working. And I'm just going to go in circles. So it's just, conventional is not a way. I hope my rest of my life, I never have to go on an antibiotic ever again. I don't want to ever do that again. So yeah.
How's your headaches?
I don't get headaches anymore. Sometimes I get a little discomfort here, but I don't get like the headache. And I don't really have much fatigue. I do get tired from time to time, so I got to take it slow. I don't, like I said, I don't have the burning skin anymore. Sometimes I do get the sweats, but I don't get, and my liver's been healed. I mean, I'm due for a checkup with my GI, but I'm not, I have to make an appointment, but
I
yeah, I
love that.
don't.
Wendy, I love that. You're like, oh, I have a checkup coming up. I should make an appointment. I love that. Love the confidence. Very good. Very good.
So I
Happy for
just,
you.
my eye is just focused on getting better, and I'm getting there. It's a slow process, but I'll get there eventually.
Very good.
The conventional just didn't work for me. With the Bartonella and the Lyme, it's just, with your genetics, it's just tricky. So I think that conventional drugs don't penetrate where it needs to be. And I don't think it gets to the root of the problem, like holistics can.
I agree, of course, I agree. One thing that really resonated with me, with you, Wendy, was that your feminine hormonal issues also resolved with the herbal protocol, right?
Yes, it's calmed down a lot.
Good.
When I went on your protocol, it came back. I am in perimenopause, so it slowed down, but my other integrative doctor that referred me to you told me that. But at first it was just, I wasn't like, my menstrual cycle had a mind of its own. Like, I would get a period, it would last 2 weeks, and then I would get it, and then I wouldn't get it for 3 weeks, and then I wouldn't get it for like 4 months, and then it would come back, and then it would be normal, and I would have it for a week, and it was all over the place. And I had like a mind of, I didn't know if I was going to get it, if I wasn't going to get it. I didn't know if it was normal. And at the time when I had a GYN checkup, everything was normal, but it just, and then when I went on your protocol, it just normaled out. Like, I was getting it every 4 weeks, like I was supposed to. And it was normally out, but it was just crazy. I knew it had to do with the Lyme, because I had spoken to people and they were in their 20s and the Lyme was messing with them. And I think the Lyme was bringing them into menopause, they said, on different blogs, people that I read, because I didn't know, at first I didn't know it had anything to do with any of it until I started researching it, and I realized that it did, that it affects everything. It affects your gut, and your gut's the base for everything, for all your organs to function correctly.
Very
I
much.
learned a lot.
Yes.
Makes you learn a lot.
Yes, it does, doesn't it? And this way, after you help yourself, many of my patients, they sometimes recognize the signs in other people, and they give them good information, they give them proper referrals, and they this way they are helping other people once they've gotten better. So that's something I'm sure you will as well, because you've researched so much, you've gained so much knowledge from what you've been through.
Yes, it's just, the journey's been long, but I know I'm moving up, so that means a lot. So I'm moving the direction I should be moving in. I'm getting somewhere now. I'm not going in circles anymore.
I love that. I love how you put that. Yes, you're not going in circles anymore. You found your direction, and we are headed towards your destination of health and wellness.
Yeah.
Good. See, big smile again. I love it. So, I must thank you for doing this podcast today. It'll get out there, we'll get a few hundred views, and it will help the families watching the podcast. It's good to put information out there to inspire and encourage other women who might be going through the same thing, because we know that Lyme disease and mold issues are almost an epidemic.
Yeah, I don't think a lot of people realize it either.
All right. Well, I hope you have a wonderful long weekend, and don't do too much. Make sure you also get adequate rest.
I will. I'm resting all week and I'm off tomorrow. So
awesome. I will see you at your follow-up, I'm sure. Right. So thanks once again. Thank you so much for being here. I'm really happy with your progress.
Me too. Thank you.
Well, that was fantastic, right? Meeting and speaking with Wendy today. She's quite an inspiration. And I'm sure many of you watching would feel the same way, right? Okay, well, thank you for being with me here today. I will see you on the next episode of BioNexus Health Podcast. Until then, be well, keep smiling. Namaste.
Thank you for joining Master Herbalist Dr. Jody A. Darshore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.